Welcome to Bold Talk series where creativity, leadership, ideas, innovation come together. My name is Epi Ludvik, and today I have a privilege to have a short one-on-one conversation with Richard Vincent, the co-founder and CEO of FundamentalVR. Richard, great seeing you. Welcome to our first Bold Talk series. Thank you for joining me in this, and let's dive in with some questions. How are you?
I'm good. Yeah, really good. Thanks, Epi. Privileged to be on this with you and to be the first. So thank you for bringing me in.
Well, thank you. Thanks for joining. So we'll just go dive in with some questions that I have. And so truly looking forward to this. So first question that I have for you, Richard, tell us, how did the journey begin with Fundamental VR and why the focus on healthcare?
Sure. Yeah. So how did the journey begin? Well, I guess if we back up, my background is 30 years in technology across a multitude of different key techs. But what stitches them all together is really they all had the potential to have a major impact on kind of the consumer human technology interface, and certainly immersive technology. And my choice to go into that a few years ago was driven by that same desire. So really, the journey began with Fundamental VR back in, I guess, 2012, when immersive technology came back into focus for me. Obviously, it's been around a long time, but it had been out of favor, hadn't been very capable, and it started to become really clear in 2011, 2012 that was going to change. And as a technologist, I believed that, and do believe that, immersive tech will fundamentally change the human computing interface. It will take us a few more years to get there, but I think it's happening, which is why I call the business fundamental. And we decided, when we decided to go into the immersive space, we then just needed to decide which sector to really focus that onto. And that was pretty easy, really. There's nothing really more meaningful or useful or beneficial to society than the pursuit of medical excellence. And as I started about 10 years ago delving into this space, what became clear was that there's a problem in the healthcare field, which has been around for many, many years, 150 years. And that is that it's difficult, it's slow, it's dangerous, and it's often very expensive to train people in surgery and all of the areas around patient care. And we felt, and I felt with my co-partner and co-founder, Chris, that we could really make an impact on that space using immersive tech. So that's kind of how Fundamental started, and then how we positioned it and pushed it into the medical space.
Nice. That's amazing. So now innovation often requires taking calculated risks. Can you share an instance where Fundamental VR, took a bold risk that paid off and significantly advanced the company's mission?
Yeah, absolutely. I think for me, that's quite an easy one. I mean, you're right. There's lots of risks you take as you're putting a business together and trying to work out, particularly in technology, how to kind of get ahead of that innovation curve and to ground it properly. But I think that the standout one for me was really the area of haptics. So that's the sense of touch, of weight, resistance, force feedback. It's kinesthetic haptics. So I was sitting with a panel of surgeons probably about 7 years ago, maybe 8 years ago now, and asking them how important the sense of touch and resistance was within surgery. And they were saying to me, well, it's essential. Often we can't see what we're doing. We need to feel the tissue, the patient, etc. And so it was clear that we needed to make haptics work within an immersive space, and that's what we've done. The problem with haptics is they're really complicated. You're talking about really sophisticated physics algorithms that you need to work on to understand space and proximity and how different items collide with each other within that area. And it's an area that a lot of people shy away from because it's so difficult. But we decided to take it on, and it's been a continued focus for us. So it's now 6-7 years of both technology and also clinical investment into understanding the sense of touch and weight resistance within different clinical and surgical scenarios. Because I believed then based on what they told me, and I believe today based on what I know now, the difference between a good simulation and an almost virtualized real life practice is the sense of touch, because it changes it from a process of going through steps to an interaction with a virtual human being. And so that's probably the biggest risk we took. It's one of the biggest investments we've made in the business, and we continue to make, to really stay right at the forefront of that really complex and difficult technology, and then to apply it to probably the most difficult use case, which is the human body. I mean, my team who work on that, they constantly blow my mind when it comes to the things that they're able to achieve with our haptics technology.
If you knew how difficult it is, would you ever start?
Yes, I would have started knowing that. And I knew that pretty much within 6 months, we knew how hard it was going to be. But yes, because it's the difference between a game and a real life experience.
That's amazing. Now, in realm of medical technology and VR, what unique leadership qualities do you believe are essential to drive your team towards these transformative breakthroughs that you're working on?
I think it's a good question. I think that being mission driven is really important. You know, having a true North Star that people can coalesce around and contribute towards. You know, and it may be a place that you never actually get to, but you need to have that star that you're pushing towards. And for us, that's something we call pre-human competence. So achieving a level of competency within an immersive environment that means that you can go into a real life environment and be safe and have good patient outcomes and achieve the objectives you have. So I think really for us, it's been about holding to that North Star, to that true mission, making sure that I continue to reiterate it, to restate it, to engage people around it so that they understand what it means. And ultimately, it's about maintaining focus in kind of three key areas, I guess. So it's improving access to good education and good training and good skills transfer through what we do. It's about reducing cost by giving it scale and removing a lot of the infrastructural costs that would normally be around that sort of skills transfer. And then ultimately, it's about improving patient outcomes, about giving them something that giving a better outcome to the patient, and actually also to the surgical team, so that they know they can achieve more and have the confidence to do that.
Yeah. Well, that's so true. Creativity follows commitment, right? And creativity often fuels innovation. Can you share with us a specific creative approach or idea that has led to a groundbreaking innovation at FundamentalVR?
Yeah, I think again, we've broken a lot of immersive tech boundaries in the work that we do in haptics, and also in the way that you simulate and virtualize tissue deformation and soft tissue within a simulation. I think really trying to create the environment where you can create and rapidly learn and fail and try again, to create the environment where you can do that within both the tech team and our design team has been really, really important. You know, when we started, there were no haptic engineers. You know, that wasn't a thing that really existed.
You had to create one.
So we had to create them. Yeah. So you went off and said, okay, well, what type of person do you need? And then how do you foster an environment where they can excel and really come to life and bring those great capabilities with them? And so creating kind of rapid development clusters that allow them to work in that way, recognizing that, you know, they're not necessarily going to be the type of mind that cracks some of these problems, aren't necessarily going to be the perfect conforming employee, and that's okay. You just have to work out how you can kind of pull those different bits together to get the right outcome that you all want, which is to get that groundbreaking innovation. And certainly I think we've done that with the in the haptic space, but also in the simulation fidelity space. You know, getting the highest quality simulations that you can get.
Yeah. Now, looking ahead, what audacious goals or visions do you have for FundamentalVR's role in shaping the future of medical training, knowing that how hard it is?
Yeah, I think I certainly say to my team and our customers and our partners and our users, I think we're changing an industry here.
Mm.
We're taking a significant role in that. It goes back to my point about pre-human competence. I firmly believe, and I know that healthcare providers do, that every surgeon, every interventionist, every team that supports them, every nurse should have access to a safe place to rehearse and try different procedures. And to do that is not easy. There's a lot of points on that, and we need commitment from us. We need commitment from industry, from professional bodies, from the providers, together to come together to try and achieve that. And we're doing our bit, and we're looking for the partners who'll support us with that. And there's lots of them. And we've seen some great lean in from some fantastic organisations to help us with that. Some of the points on that really, though, are around having a goal, which I have, which is that using VR in any environment should be as natural and as native to you as using a browser. You don't think about a browser now. You know how it works. You just get on one and you start using it, whether it's a Google, whether it's Chrome, or whether it's Safari or another browser. You kind of know how they work, right? We've all got it. We need to get to that same place with VR and immersive technology, so that people aren't having to learn user interfaces and UX. They can just get on with using the experience. And that's kind of what we're really looking for. So, my audacious goals for the business is really to standardize, to create uniform environments that people just know, because it's set to a standard. And I think that's what we'll be working on over the next few years.
Yeah, that's amazing. Now, as a CEO, how do you personally foster creativity and innovation within your team, and what leadership lessons have you learned in this process while doing it?
Wow, I've learned lots. that's for sure. Yeah. They say you learn the most from making mistakes, right? So I've certainly made my collection of mistakes along the way, and maybe got a few things right as well. I think certainly in terms of trying to foster that creativity and that innovation, we did a lot of it's little things. It's about recognizing people's contribution quick and early, and celebrating it. Celebrate success, also celebrate failures. Again, it's a Zuckerberg statement from many years ago, but fail fast is really important. Try it, find out it doesn't work, move on, and keep doing that. And so, one of the things we've done at Fundamental is we have a thing we call Fundamentally a Star, which is an award we give out every quarter, voted for by the team, for somebody who perhaps doesn't necessarily get all the headlines, but actually in the works is just doing stuff above and beyond to drive through our objectives. And we recognize those people. We also, every week, twice a week, we bring the whole team together for 10 minutes just to, again, showcase a little bit of innovation and showcase one person and let them tell their story, so that we get to know each other. We get to celebrate innovation that's going on within the business. And I guess personally, I guess what I've learned as a CEO is you've got to keep things really simple. The hardest thing to do is to simplify. It's really easy to be complex. It's hard to simplify. So I keep a mantra going all the time, which is about, how does this make the boat go faster? Which draws from Ben Hunt Davis and his Sydney Olympics 2000 team, where they had a preoccupation, which is like, if what we're doing today isn't going to make us row faster and win the gold, which they ultimately did, if it isn't going to get us there faster, then let's not do it. And I have the same mentality with the business. I keep saying to everybody, just ask the question, how does this, in any small way, help the boat go a bit faster? And if the answer is, if you can find the answer to that, then keep pushing. And if you can't, then maybe you just need to drop that and move on to something else. So simple messaging, simple focus, simplify. I think that's the key message for me.
Yeah, adding that 1 extra %, I always say, like, before you just turn off your laptop or your work, if you just can add one more thing every single day, you are one more thing better off every single day, 30 days, 90 days, 365 days, and that adds up collectively. So yeah, that's really amazing. And reward, I mean, this is another thing about the recognition. I think there's really a big number that number. I think there's number one reason why people leave their jobs is because of they don't leave the jobs, they leave their bosses, or they leave the leadership, but they also leave because of recognition. So you truly touched on that. Final last thoughts on any bold thoughts, Richard?
Um, any bold thoughts? Wow. Well, I guess, for me, being bold is a mindset, and it's certainly one that I've always tried to have. Not being scared to stand up and be seen is important. I think I try and foster that within the whole organization. And every day it's hard to do that, but it's the difference between mundane and excellence. And so, putting yourself out there, being ready to make mistakes and being seen to make mistakes is bold. And when you make mistakes, you innovate really fast and you learn your most. And certainly, as I said, mistakes I've made over the last 25, 30 years, they've been my fastest learning curve. So I think being bold is all about having the mindset of it's okay to expose yourself, to be out there, to show yourself and put yourself, in front of people fully, knowing that there's weaknesses in there that you're exposing to, because I think that's when you really show your inner strength and your boldness. It comes from just learning to kind of let yourself go, let yourself fly a bit, and don't be scared of how high you get, because you can always recover.
Yeah, I always say you got to have your triple A, which is like acknowledge, accept, and take actions.
Exactly. Yeah, exactly.
Great. Well, Richard, thank you. I always be bold. Congrats on all your achievements so far, including even winning our last Bold fourth edition in 3 categories. That was health tech, robotics, and metaverse. That was the first time that ever happened in our history of Bold Awards. Thank you for joining me, and looking forward to our next conversation, hopefully in the near future. So always be bold, Richard.
Thanks, Epi. Back at you. Always be bold, my friend. Good to see you. Always a delight to have a conversation. Take care.
Thanks, my friend.